When most people think of estheticians, they picture relaxing lavender aromatherapy and gentle facials. While that pampering might be ideal and sufficient for some, other people need a little more help to get certain skin conditions under control, and that's where medical aesthetics come in. Welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so you can have healthy, beautiful, comfortable eyes. Give a little love tap on that subscribe button to stay up to date with all the latest eye tips and tricks I have for you. So today we're going to talk about medical aesthetics. Medical aesthetics is practiced by a licensed esthetician who works in a medical setting alongside healthcare professionals. They generally work with doctors on clients who have more severe and complex skincare conditions. And medical estheticians help patients with skin conditions, skin traumas, and aging skin to heal and rejuvenate the appearance of the skin. They can administer chemical peels, microdermabrasion, laser therapy, and even potent acids. But is a medical esthetician a real thing? So before we dive into what a medical esthetician actually is, we need to talk about the usage of the term medical. Not only can that term intimidate those who would want to go into the field, but it can also be misleading to some people like patients. In fact, the NCEA, the National Coalition of Estheticians, Manufacturers, Distributors, and Associations, has stated that estheticians should market themselves only by the title appearing on their license and not promote themselves in any other way. In the state where I practice optometry and own an aesthetic salon, there is no such thing as a medical esthetician. Well, why does that matter? Because there's technically no such thing as a medical esthetician, at least not currently, and there's no state recognized licenses that would be titled as such. Basically, a medical esthetician is licensed the same as a regular esthetician, so it kind of means nothing except that they're practicing maybe in a medical office, but training-wise, an esthetician is an esthetician. And that's the reason some, like that organization, the NCEA, think the title is misleading, because the esthetician isn't required to have any formal medical training or knowledge other than what's taught in a standard beauty school aesthetics program. And of course, their training will vary depending on if they're with an optometrist or a dermatologist or they've gone to specialized training. They may very well have specialty and advanced training, but it would be very dependent on the clinic that they're in. Okay, so let's talk about what a medical esthetician theoretically could be in the right medical practice. So a medical esthetician in theory could provide advanced medical level skincare. They would be trained to be familiar with chemistry, nutrition, pharmacology, and advanced makeup techniques while working with chemical peels, exfoliants, and other more intensive treatments, and in my opinion, have some understanding of the pathophysiology of the treatments that they're doing. They can work for doctors and on patients who would have more complex skincare needs, and even have training in IPL and lasers and more advanced procedures. Now, that would be in contrast to an esthetician, a non-medical esthetician who provides skincare services to those with healthy skin in a non-medical setting. They would more likely be working in a spa, a salon business, or other non-medical type of setting. They would potentially do more facials, waxing, extractions, and just basic chemical facials, but not necessarily have the training to work alongside a dermatologist. They would not, for instance, become comfortable with advanced chemical peels, maybe even tinting or more aggressive acne treatments. So even though there's not a difference in terms of licensure, there's potentially a major difference in the way your esthetician is practicing. So this term medical esthetician is really not a thing. They're all estheticians, but like any type of doctor, you're going to have your areas of specialty, and you may be going to a dermatologist or an optometrist who has a quote-unquote medical esthetician in their practice, which they should not be promoting them or marketing them that way because it's not a thing, but you're with me, right? I hope. Okay, so in the case where you have a more medically based esthetician, they could have more of a clinical focus. And we see estheticians that do work with cancer patients, burn victims, patients with severe acne, or in my clinic, patients with, severe rosacea and ocular rosacea. You can find estheticians actually in hospitals, rehab clinics, and medical spas, as well as dermatology, oncology, or plastic surgery offices, and more frequently now even optometry offices because of the overlap between aesthetics and dry eye syndrome. So another big difference is that an esthetician will call their patients clients, whereas a medical esthetician or someone working in a medical office will call their people patients, right? So that's a huge difference between a spa and a medical setting. And a medical esthetician can work in medical settings like hospitals or trauma centers, whereas an esthetician really couldn't without more training. So let's talk for a moment about the difference between an esthetician and a dermatologist, of which I am neither. These are both skincare professionals, but they have very distinct expertise, and there's a huge difference in the kinds of services they offer. So an esthetician is a skincare specialist. They're going to provide services geared toward improving the external appearance of skin, whereas a dermatologist is a medical doctor, a surgeon, and they specialize in the health of your skin. Dermatologists are doctors, and estheticians are not. Dermatologists are trained to diagnose specific skin conditions and treat them. They might, for example, prescribe prescription medications or perform in-office procedures, from removing cysts and growths to performing skin cancer biopsies. Estheticians, on the other hand, perform treatments that target the surface of your skin, like a facial or a mild chemical peel. Understanding the difference between an esthetician and a dermatologist will help you figure out which expert is better suited to resolving your specific skin issues. And that's why I made this video detailing the two professions to help you make an informed decision. But as an optometrist, eye care provider, and dry eye specialist, I actually recently added an esthetician at my dry eye practice. Because aesthetics and dry eye are much more closely related than anyone thinks, I actually made an entire video about when I introduced visionary aesthetics to my practice to inform patients about makeups and skincare near the ocular surface. It might seem odd to hear of an eye doctor with aesthetics in their clinic, but in actuality, optometrists have a unique opportunity to be a key player in the field of ocular aesthetics. I am not a skincare professional. I do not represent myself that way, but as a dry eye specialist, I work with many patients with ocular rosacea, and I think that there's a really important place for optometrists to work alongside dermatologists and estheticians to help our patients look our best and have their eyes be comfortable and healthy. Historically, ocular aesthetic services have primarily focused on surgery, like blepharoplasties, procedures for ptosis, entropion, and ectropion. That used to be all ocular aesthetics was. However, recently there's been more of a shift to a non-surgical description, one that includes not only the eyes but also the skin and face. And as an OD, over the past 10 years, I've been asked about my recommended makeup and skincare routines enough times to finally realize that I needed to be paying attention to these questions and coming up with answers. My aesthetics journey started with my dry eye clinic. When patients have dry eye, meibomian gland dysfunction, and allergies, the appearance as well as the comfort of the eyes is compromised. In that case, treating the ocular surface can improve comfort, restore vision, and enhance the aesthetics of the eyes. And some of the treatments for dry eye, like IPL, have secondary aesthetic perks. IPL not only decreases ocular inflammation, but it also reduces facial skin redness, telangiectasias, hyperpigmentation, fine lines, and wrinkles. We also use LED therapies that have implications for the ocular surface and controlling inflammation associated with MGD, while also having secondary aesthetic benefits when it comes to acne and rosacea. As a practicing optometrist, I know that my patients care about their ocular aesthetics, and they should be getting their information from knowledgeable, reputable sources. In my opinion, eye care professionals should be talking to their patients about how makeup, skincare, and beauty products affect the health and functionality of the eyes. I'm passionate about this topic, and I'll link an aesthetic playlist below or above of the product reviews, preservatives to avoid, and reviews of eye-safe makeup lines. So optometrists are the predominant primary eye care providers in the US, which means that we have an opportunity and a responsibility to talk about eye health in relation to beauty and skincare products. So I've chosen to create an aesthetic clinic that has a culture of eye-focused health. I've created a protocol for facials that incorporates special procedures to enhance the eyes, and we stock eye-friendly makeup and skincare in our office. We're proactively asking our dry eye and regular eye exam patients about their skincare, their makeup, serums, and lash habits, and we take an eye history of our patients getting facials. We discuss Lumify, Upneek, and some of the other products aimed around ocular aesthetics to help our patients achieve healthy and beautiful eyes, and I did do an entire video about it that I'll show you here. So to be clear, there really is no such thing as a medical esthetician, but there's definitely a thing where an esthetician goes to aesthetics school and gets specialized training in a medical environment. So let me know in the comments how a medical esthetician or esthetician has improved your skin and your thoughts on seeing more optometrists add aesthetics to their clinics and dry eye clinics. And if you've made it this far and you're not already subscribed to my channel, please do hit the button and the bell so you don't miss any notifications. That is it for today's iSchool. Class is dismissed.